Good afternoon, ladies and gentlemen. My name is Amy. I'm a nurse clinician in Home Nursing Foundation. Today, I'm going to introduce the services that we have in Home Nursing Foundation. We have home nursing services, home medical services, and home personal care. At Home Nursing Foundation, caring for both our patients and their caregivers are of equivalent importance. We believe in providing holistic care to our patient and aim to empower their caregiver in their journey of care. In our home nursing services, our nurses carry out care assessment, care coordination, and we also take care of their wound and stomach care, tubes and catheters like male and female's urinary catheters, feeding tubes, tracheostomy, and of course, medication management. Our healthcare professionals do this by conducting comprehensive assessment at every patient visit. We draft individualized care plan in discussion with the caregiver and determine the most appropriate care intervention required. Care plan goals are discussed with patient, caregivers, and of course, their progress are being monitored and modified when needs arises. We will also assess and identify any presence of caregiver stress. When such warning flags occur, we hold multidisciplinary meetings with other team members such as our physician, therapists, and medical social worker to discuss and formulate appropriate intervention. In our home medical services, our doctors actually carry out medical consultations on chronic disease management and subacute care. They can order and review lab test results and prescribe medication. When needs arises, referral can be made to other care providers, for example, the hospice care. Our doctors carry out severe disability assessment and interim disability assistance program for the elderly. To better support our caregiver in their caregiving role, we design caregiver training sessions to impart family members and their helpers essential caregiving skills, techniques, as well as various resources that are available in the community to aid their caregiving journey. When we conduct caregiver training sessions, we perform actual demonstration of skills and get the caregivers to perform return demonstration to ensure they are confident and effective. Besides hands-on, the caregiver training sessions is supported by practical, theoretical information to share with them the disease process, rationale of care intervention, as well as step-by-step guide. They can also learn basic behavioral management skills to cope with the demands of caregiving. This will empower the caregiver and greatly boost their confidence in caring for their loved one, even on the days when they are not visited by our nurses from HNF. If there's a need, we will also refer our patient for home personal care. The care pros can provide personal hygiene, companionship, and mentally stimulating activities. They can assist with light maintenance exercises, assistance with grocery shopping, light housekeeping, meal preparation. Elder seating and respite care can be provided if required. And of course, medication reminder. Let's take a look at one of my patients, Mr. T, from hospital to home. Mr. T, 88 years old male, widowed, basic activities of daily living dependent. He do have a medical history of diabetes, high cholesterol, and recently had an amputation of the right foot with poor wound healing. He was referred to Home Nursing Foundation for home nursing services. He required advanced wound management, and we work closely with the podiatrist in the hospital itself. Mr. T had poor adherence to medication despite pillbox packing in the hospital. He required caregiver support and financial assistance. My nurses went in to do negative pressure dressing every week, and they work closely with the podiatrist in the hospital by updating if there's a need. My nurses pack his medicine weekly and explain to Mr. T the importance of certain medication. We managed to get his nephew in for caregiver support, care and concern for Mr. T. Mr. T was also referred home personal care services for personal hygiene and light housekeeping. We roped in our medical social worker to perform financial support for out-of-pocket costs for home visit fees. We apply senior mobility fund for his wound care consumables. As a result, Mr. T wounds improved and stepped down from advanced wound care. His medication compliance also improved, and currently, with his nephew's help, he received great caregiver support Mr. T now is able to stay on in the community. If there's any needs or any queries, feel free to contact us at referrals@hnf.org.sg or enquiries@hnf.org.sg. Thank you.